Hey, hey, hey. Welcome, 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 everybody. Welcome to the Dude Nurse Show. I'm your host, the Dude Nurse. Actually, my name is Greg, but you can call me the Dude Nurse. What I wanted to talk about today is something that unfortunately is quite common in healthcare, and that is oftentimes when you folks see multiple providers, do you ever stop and wonder if those providers really communicate amongst one another? And sadly, the answer is no, they do not. Oftentimes the right hand does not know what the left hand's doing, and vice versa. So here we have you, the patient, who is at the center of all this, and as it should be, you should basically almost kind of be, your own quarterback, if you will. It's kind of gotten to that. We oftentimes look at doctors and nurse practitioners and PAs and specialists of all kinds, the various folks that we see. We trust them. We entrust our lives, our care to them, and they do a pretty good job. But is that enough? And that's something that I kind of wanted to look at today. So what we're going to talk about in today's episode are just a couple of ways, 3 tips that I have for you guys on how you can prevent medication interactions. Now, what do I mean by medication interaction? A medication interaction is where a particular medication that you're taking can interact with another medication that you are taking. Or it doesn't have to be prescription. It can be something that you take over the counter. It can be some of the food that you eat. It can be supplements, vitamins, herbal remedies, all of those kinds of things. And let me just say right off the bat that I have absolutely no issue with any kind of herbal remedies or anything of that nature. I just ask my patients to let me know what it is that they're taking so that we can be aware of any potential interaction. In fact, some medications are contraindicated with certain types of foods and things like that. For example, if you take an anticoagulant called Coumadin, also known as warfarin, you need to be really careful with those green leafy vegetables, your broccoli, kale, spinach, all of those kinds of things, or anything for that matter that is high in vitamin K, because it will basically interfere with how that medication does what it needs to do, which is thin your blood. And it's an anticoagulant or a blood thinner. But don't want to dive too deep into anything specific, so we're just going to go ahead and jump right in. One of the main things that I tell my patients and their families, sometimes you have a loved one that you like to be in charge of kind of your healthcare. Maybe not necessarily in charge, but highly involved, and that's okay. We encourage that, assuming it's okay with you, the patient. If that's the case, ask questions. Even if it's not the case, ask questions. It seems so simplistic, but yet it is oftentimes so overlooked. People sometimes get the mentality that oh my goodness, the doctor's busy. I don't want to bother him or her, or if it was important, my doctor would have told me. Please, please, please do not operate under that assumption, because doctors are human. They are not infallible. No one is infallible. So they oftentimes forget to explain things to people. And it's our job as nurses to make sure that you, the patient, have all the information that you may need. And so, like I said, ask questions. Ask the nurses questions. If it's something that you really don't understand, make sure that you understand this is your health. This is your life. This is your treatment, and you need to know what to do, because at the end of the day, if you don't do that, then you're not going to be getting the proper treatment, and you're not going to have the best relationship with your provider that you could have. If you if you have concerns, about side effects or other medications, ask them why did they choose this particular medication, because sometimes there can be another alternative that works just as well, but perhaps it's cheaper. Or maybe this doctor chose this particular treatment, although it may be a little more expensive, but it has less side effects. So then, you got to kind of weigh the pros and cons, but don't let the physicians, the doctors, weigh those pros and cons for you. It's not their money being spent. If you have, like I said, if you want to go with a cheaper option that has a few more side effects, that's your right. If you want to go with the more expensive option that has less side effects, by all means, go that route. But again, I cannot stress enough that you ask questions. Okay, I got my handy dandy notes here, moving right along. Number 2, and this is one that a lot of people don't know about. A lot of people will just kind of go wherever they think may be the most convenient for wherever they are at that particular point of the day or that week or whatever. They'll go to multiple pharmacies, and the tip is that you really need to get your prescriptions filled at the same pharmacy. I know that sometimes you might be able to save $1 or $2 at a different pharmacy. And again, I'm not trying to tell anyone how to spend their money, because I watch my dollars and nickels just like everybody else. But you're more likely, or I should say the pharmacist is more likely to catch potential interactions. If you have all your prescriptions filled at the same pharmacy, they will know what medications you take on a regular basis. If you take what we call maintenance meds, let's say you've been taking the same blood pressure pill for the last 20 years, and you take the same a pill for depression, and you've got a pill for your prostate, and you've got a pill for this and a pill for that and a pill for your diabetes, and those are your what we call maintenance meds. They will already have those on file. And so let's say if you go see your PCP, your primary care physician, and they say, something's kind of going on with your kidneys, I need to refer you to a nephrologist, a kidney specialist. If he or she puts you on new medication, you'll want to, again, get that filled at the same pharmacy, so that the pharmacist has that final look at your medication profile, and they can communicate with you as well as the physician and say, hey, this medication interacts with this medication. It's contraindicated for this particular use, because doctors will sometimes prescribe things what we call off-label, meaning that they'll prescribe it for something that's not necessarily what it was intended for. Like, for example, the drug Viagra, or the generic is sildenafil. It was originally a blood pressure medication. It's what's called a vasodilator, meaning that it opens up the blood vessels. So they found that it had a side effect on gentlemen's, and it caused big strong like bull. It would help with erectile dysfunction. So, but that was not what the medication was intended for. Like I said, it was a blood pressure pill. So make sure that you're going to the same pharmacy as much as possible. Which kind of brings me to the final tip is if you for some reason you cannot go to the same pharmacy, or even if you do go to the same pharmacy, you always want to have an updated list of medications with you. Whether you store them on a computer, update it however often you go, so that every time you go and see your doctor, not just your primary care physician, say you see an oncologist, then maybe you're battling some cancer, maybe you see an endocrinologist for your diabetes, and maybe a pulmonologist for your COPD, and you see a gastroenterologist for some stomach problems, and then that nephrologist that we talked about is now seeing you for your kidneys. Trust me, folks, they are not going to bounce this information back and forth. It's going to get lost in transition. I promise you. I've seen it happen numerous times. I've seen people that had lists, they say, well, I haven't updated it since, the Nixon administration, but, now the medications change, whether they change the dose, they change the frequency, that needs to be updated. And that even if you take a medication for a short time, put it on the list, and then have, like, if it's just a short term, say you're on an antibiotic or something, put a start and a stop date on there, and again, make sure that list is up to date. And every time you go see a doctor, give them an up to date copy of your prescriptions, because they will not have it. I promise you they won't. I've seen as many as 4 and 5, 6 different prescribers when I sit down with a patient and they unload this massive bag of medications. You wouldn't believe how many different medications that some people take. Maybe you would, for those of you that unfortunately have to take a lot of medication. And I can't tell you how many times I've seen, so wait a minute, you're taking this and this, and they're the exact same class of medication. They're taking it for the exact same thing, but nobody bothered to do what we call a medication reconciliation with the patient and go, oh, okay, you have what we call a duplication in therapy, and that's not good for the patient or for their wallet. And then too, if they would have gotten it filled at the same pharmacy, I'll see 6 different pharmacy labels. I'll see some that are mail order, some from CVS, some from Walgreens, some from Walmart, some from Kroger, or whatever local grocery store that you have, and they'll get them filled right there. That's where a lot of times the doctor's offices or the ERs or urgent cares or whatever, they'll say, yeah, do you have a preference? And you're like, just whatever's closer, and they'll just call it into whatever's local. That doesn't really help you much, if you are on quite a few different medications. Like I said, I implore you to get them filled at the same pharmacy. And by doing that, it will help to cut down on interactions, contraindications, as well as duplications in therapy. I know I said 3, but I'm going to leave you guys with one last bonus tip, and that is talk to your pharmacist. He or she is really the go-to for questions on your medication. They can tell you different options. They can, say, hey, this is a brand, but it works the same as the generic. They really are the foremost authority when it comes to medications. That's what they go to school for, and they spend a long time in school learning about the medications. I know sometimes, and I had done it before, you go into your local Walgreens and the pharmacist is back there and you see somebody, can I check out back here for a stick of gum? Well, yeah, they may run a cash register, but they're still a pharmacist, okay? And they can help you with any medication questions that you have. They have knowledge about various diseases and processes. They're not doctors. They're not doctors of medicine, medical doctors, but some of them have what they call a PharmD. They're just a wealth of information, and you can walk up to them and ask them any kind of questions. Hey, I'm taking this new medication, blah 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 blah, and he or she will always be happy to help. So hopefully you guys have enjoyed this. Just to kind of recap and bring everything back, you need to first and foremost ask questions, stay informed, okay? A little side note to that, when you're looking on the internet, make sure that what you're looking, the information you're gathering, is from a respected source, okay? You can look at the author if it's a blog or whatever. I'm not saying that it's not a good source of information. I myself run a blog. It's called thedudenurse.com. So please feel free to check that out. But if it's just some Joe Blow, they're not credentialed. They're not a nurse or a doctor, or they're just writing about whatever because they're bored. The information might not be so good. So just be careful with that. One little caveat to that. Asking the questions, staying informed. Again, get your prescriptions filled at the same pharmacy as much as absolutely possible. And if for whatever reason you can't get it at the same pharmacy, make sure you add it on your list, and make sure that the place where you do kind of call your home pharmacy, make sure that they know that you're taking it as well, okay? Because it needs to be put on your med profile. Even if it's just a quick antibiotic, I would let them know. Last but not least, always keep that list up to date. No matter how often it changes, if you were on 5 milligrams, now you're at 10 milligrams, update it. If you were taking it once a day, now you're taking it twice a day, update it. No matter what it is, anything added, subtracted, whatever, update that list. Every time you go to the doctor, bring a current med list and you give it to them. Don't wait for them to ask, because chances are they won't. Just give it to them. Say, here's a copy of my updated medication list, okay? And even if you've given it to them 10 times, every time you go see that doctor, take in a copy of your meds. I promise you, it will benefit you in the long run. Thank you guys for tuning in. Until next time, the Dude Nurse saying, be well.